Recording in progress.
Hello everyone. Welcome to part 2 of pre-rehab videos. In the pre-rehab, we are talking about several strategies of how we can prepare ourselves for upcoming cancer treatments. So for several weeks leading up to your cancer treatments, whether it is beginning of chemotherapy, radiation, medical surgical procedure, there are several strategies that you could do to empower yourself just so that you can go through the treatments better and you can come out stronger. This is the first part of universal interventions, which is breathing exercises. So I am going to go over a medical disclaimer, which is basically indicating that I have tried to put forward the most evidence-based research and practice for helping you and empowering you. However, there is always changing evidence, and I would like you to look up more evidence if you are interested in these topics. This was the first part of the lecture where I have broken down the entire rehabilitation into pre-rehab, rehab, and then survival. In the pre-rehab, we have 4 strategies of screening, assessment, interventions, and monitoring. In this current lecture, I'm going on to the intervention part of pre-rehab. If you want to know more details about all of these strategies, the theory part of it, please refer to my lecture before this one. Pre-rehab, as I mentioned, is broken into 4 parts, and we are talking about the universal interventions. And the first part of the universal interventions are the breathing exercises. There are 4 different types of breathing exercises that you could do. You could do all of them on a particular day. You could pick one of them, like from picking a tool from the toolbox. You could alternate them. You could do one on one day, the second one on the third day, and keep repeating them. They all complement each other, and they are really good by themselves also. So I encourage you to learn all 4 of them, practice all 4, or pick one of your favorite ones. These are all your tools that we are getting ready for your toolbox. As I mentioned, breathing exercises have several physical and mental benefits. The most common physical benefits of breathing exercises is improved lung function, improved oxygenation, improves your tolerance to go through all the procedures and the medical treatment. It improves your aerobic capacity so you can get back to doing what you were doing faster if you can practice these breathing exercises. It also improves the lymphatic flow in your entire body, which prevents infections and provides better immune support to your body, and it improves circulation in the entire body, not just your lungs and your chest. The mental benefits of breathing exercises are down regulates the nervous system at many different levels. We are upregulated because of the stress and the anxiety of what's going to happen, the fight and flight response that our body gets into. Breathing exercises can down regulate your nervous system and help you tolerate and go through the procedures a lot better. So most important benefits are decreasing the stress and the anxiety, improving your overall mood, helping you sleep better, helping you sleep deeper. It obviously lowers down your blood pressure and your heart rate. It boosts your immune function by improving the lymphatic flow in the system, and it definitely helps you to tolerate the pain better. It has a lot of pain relieving benefits. So let's go on to the first breathing exercise. This is a little bit of research which shows that breathing exercises has shown to reduce the length of stay in the hospital, has shown to reduce pulmonary complication, especially pneumonia, and it has shown to improve the cardiovascular capacity of an individual who have practiced them before the surgery or before the start of the treatments. The first breathing exercise is lateral thoracic breathing, where you're focusing on the upper part of the chest, upper part of the body, and you're focusing on the movement of the chest. I have a short video which is demonstrating this technique of breathing. So let's go on and learn how to do the thoracic and lateral breathing exercise. The first technique of breathing technique is thoracic breathing, a really simple technique. You could practice this by your bedside, in your bed, on your chair, in your car, on a yoga mat. Doesn't need any preparation or any equipment. It just needs intention of doing the breathing practice. So let's go on and start with the first breathing technique, which is thoracic breathing. In this, I like to use my hands so that my brain and my body has tactile feedback about the part of the body that I'm working on or trying to pay extra attention to. So I'm placing one hand on the outside of the ribs and one hand on my upper chest, and I'm just going to take a nice breath in and breathing out. When I take a breath in, I'm making sure that I'm not sniffing. I'm not doing that. I'm not using my accessory neck muscles. I'm not breathing from my muscles right here, but I'm rather using my intercostal and my diaphragm to do the technique. And I'm taking a slow, long inhale, trying to open my ribs outwards and my chest upwards. So almost like inflating a balloon. So I am doing and breathing out. In this, we breathe in from the nose and out of the nose. The next form of breathing exercise is diaphragmatic breathing, where we are focusing on the lower half of our body and we are using diaphragm, which is the big breathing respiration muscle at the base of our rib cage, our belly and our pelvic floor, to do good breathing into the belly, into the pelvic floor, underneath your diaphragm. So my next video is going to demonstrate the diaphragmatic breathing. So let's go on and learn that. This is the second important breathing technique, which is diaphragmatic breathing, but it involves movement of the rib cage and the diaphragm. So this is how it looks. You breathe in from the nose, again making sure of not using your upper neck muscles, but rather using the outside of your ribs and your belly muscles to increase the depth of your breathing. We are focusing on the inhalation, taking slow, soft breath in. Ribs open outward, belly rises upward. And when we breathe out, belly drops in first, and then the ribs follow. Very, very important to make sure that we are not putting any pressure or we are not bulging our belly. Very, very important to make sure that we are not putting any pressure on any part of our body to increase the depth of the breathing. By gradually practicing this technique, your depth of breathing will automatically increase. We are right now just focusing on the coordination. We are focusing that every time you inhale from the nose, your ribs are moving outward and your belly is softly rising upwards. And every time you exhale from your nose or your mouth, your belly goes in first and then the ribs close. So this is how the technique looks. Breathing in, my ribs are opening in 360 degrees and my belly is softly rising upwards. This is a wonderful form of breathing. It's called alternate nostril breathing. This not only helps you to have deeper breathing into your thoracic region, but it also down regulates your nervous system. It has a wonderful benefit of calming your entire nervous system down, especially your vagus nerve, which is going to help you to move into rest, relax, and digestion mode instead of a fight and a flight mode that can happen because of the diagnosis or upcoming treatments. A very, very simple form of breathing again. We do not need any equipments here. You just need to sit in a calm, comfortable position. You want to think about breathing in, close one nostril softly. Breathe in, for example, starting from the left, breathing in from the left, closing your left, breathing out from the right, breathing in from the right, closing your right, out from the left, in from the left, closing the left, out from the right, in from the right, out from the left. In this manner, you can repeat several cycles of alternate nostril breathing, closing your eyes, focusing on good, deep opening of the ribs and the thoracic region, and just calming your entire nervous system down along with getting more oxygen. One more technique of breathing is called incentive spirometer. It requires a small device which is called the spirometer. Wonderful form of breathing again to help your lungs open up in several different regions. So 360 degrees opening of your lungs using the spirometer. My video is going to demonstrate how to use this very simple device for this technique of breathing. This last form of breathing exercise actually uses a really simple device called incentive spirometer. Highly recommended to be used after your surgical procedures, but I would recommend you to start using incentive spirometer as one of your pre-rehab breathing exercise so that you can use it better after your procedure and you're already improving the depth of your inhalation, the strength of your breathing, giving your body more oxygen to heal and recover faster. So the way this incentive spirometer works, we have a piston that indicates how deeply you are breathing in. We have a mouthpiece through which you are going to inhale. You can exhale from your nose or you can exhale from your mouth. But inhalation happens through the mouthpiece and the depth of your inhalation is indicated by these numbers indicating how high or how deep you are breathing. So this is how it works. You want to clean up your mouthpiece, sit in a nice comfortable position like any other breathing exercise. Take a deep breath in. Breathe out slowly and fully, either from your nose or your mouth. Before your next inhale, you're going to put the mouthpiece and slowly shut your lips around the mouthpiece. A very simple device found by your bedside, mostly should be given to you when you are discharged from the hospital after the surgical procedure, but you could buy it off Amazon or any other medical equipment store. I hope you enjoy doing these breathing practices. And in short, I highly recommend you to practice one or all of these breathing techniques because just few minutes of breathing per day not only has physical, but it also has immense mental benefits. And all of this is going to empower you to go through the treatments better and come out a lot stronger. My name is Raj. I am the owner of Om Physio PGH, a physical therapy service specializing in oncology and pelvic floor conditions. I hope you enjoy these videos and follow along with me for a few more in future. Thank you.